So I'm Michael Sharpe. I work at the University of Oxford in the UK, and I've done work over 20 years on trying to improve the care for people who have cancer and depression. And what Kelly is doing here is to extend that work to people who have cancer and severe mental illnesses like bipolar disorder and schizophrenia. And this is a really important next step to really including people with all sorts of mental disorder in improving their cancer care. I'm an MD, I'm a professor of psychiatry at the University of Oxford. So there's a problem with medical care in general, and it neglects people to management of mental illness in people who have it. This is a general problem. And in cancer care, so when people have cancer and they have or develop a mental illness, it tends to get neglected. So what we're talking about today is treating the person as a whole, to treat both the cancer and the mental illness together in an integrated way. And that is something that's just not happening at present. So I am the President-elect of the Academy of Consultation Liaison Psychiatry in the United States here, and Kelly is actually a member of that organization, and that's how I connected with her. And the Academy aims to improve care for people with coexisting mental and physical illness. That's its aim. All this work of trying to improve the care of people who have coexisting mental and physical illness tends not to have included the people with more severe mental illness, and my own work hasn't. So this is a difficult but important next step in integrating care. I think it's very important to know where you want to get to, and I think there's an agreement we want to get to good care that's built around the person, that takes account of all their illnesses and doesn't just focus on one and neglect the other. Getting to that place is quite a difficult journey, and it's going to involve all sorts of aspects to do with funding, to do with training. But I think the most important thing that's happening here is to build something that people can see. Otherwise, these are just aspirations and ideas. If you actually build somewhere where they can see this quality care, where they can go for training and where the research is being done, then there's something there for people to look at and something to try and aspire to. I think the fact that the leadership is supporting it is quite remarkable, because medical care facilities tend not to concern themselves with these more difficult aspects of care. And I think the fact it's happening is really important in getting change. And I hope that then leads on to being able to do something really practical so that people can come here and see what can be done. So far, it's been a long journey to integrating mental health care and physical health care. And we are making progress, but it's been quite slow. I'd like to think there was a tipping point where it suddenly happened. I suspect it's just going to be a continuing long journey, but it is one that we're making progress on, and one where Kelly is keen making progress here.